Complex PTSD. The Complete Guide to Understanding Treating. Practical Growth Guidebook for Thriving Recovery, Mind-Body Treatment. Ernest Nilsson. Chapter 1. What is PTSD? Most people will experience at some point in their lives at least one very stressful and traumatic event. This could be the loss of a loved one, a life-threatening incident, violence, or a natural disaster. After such events, it is normal to feel confused, scared, sad, or angry. It is best to have support from family, friends, partners, and community members to overcome these emotions. If we don't have the resources or support to deal with a threatening, terrible event, our psychological and physiological reactions to trauma can continue and become post-traumatic stress disorder, PTSD. There are 3 significant PTSD symptoms: avoidance, re-experiencing, and generalized feelings. Re-experiencing symptoms can include flashbacks, intrusive memories, and nightmares accompanied by strong emotions. Avoidance symptoms are a way to avoid being in situations, participating in activities, or seeing others affected by the trauma. You may turn to addictive behaviors, such as drinking excessively or drug abuse, to avoid the past. You may feel like you are in danger, but you are safe. This is known as hypervigilance. It can cause you to feel anxious, startle easily, or be unable to relax. Complex PTSD, CPTSD, is a condition that results from repeated or ongoing events. CPTSD can occur at any age, but this book focuses more on childhood trauma. This includes growing up in a hostile environment, fear, chaos, and rejection. You may have been subject to abuse, neglect, domestic violence, abuse by your sibling, or constant bullying without anyone to protect you. CPTSD can often be caused by events that are both frightening and inevitable. However, it could also result from ongoing emotional neglect in which you were repeatedly rejected or left alone for long periods. This lack of affection from loving caregivers often provides inadequate protection against dangerous situations and people. The most important thing about PTSD symptoms is that they are learned behaviors which can UNL through practice. Relational trauma refers to childhood trauma. It is a form of trauma that affects how we relate to others. Therapy is often the best place to learn and grow. This healing relationship allows you to have reparative relationships and build new, healthy coping strategies. Chapter 2. Since Childhood. Theory of Attachment. The attachment phase of development is the first 3 years of our life.
Sample complete. Ready to continue?